I'm knocking on the door and coming on in. Hello. Hi, my name is Hafsa. I'm going to be your student nurse today, and I will be inserting a urinary catheter. Have you ever had that done before? You have? Alright, so let me refresh your memory. So according to the doctor's notes, it states that you're feeling discomfort and some difficulty while urinating. So by inserting a urinary catheter, it will allow the urine to exit your body and helping to relieve some of the discomfort you're feeling. You'll have it on for a couple of days, and once we remove it, you should be able to go ahead and urinate on your own. Sounds good? If you have any other questions about this procedure and during the procedure, please feel free to let me know. Sounds good? Alright, let me go ahead and just get your name and date of birth. Alright, you said Judy Johnson, November 5th, 1965. Let me just check that wristband. Alright, that matches my wristband. Thank you, Miss Johnson. And do you have any allergies? I don't see an allergy wristband. No allergies? Okay, how about pain? Just the discomfort? Yeah, so I'm hoping to relieve some of that discomfort by inserting the catheter. I'm gonna go ahead and just gather my supplies, wipe down my workspace, and we're gonna be cleaning up your genitals before we insert the catheter, okay? All right. All right, I'm gonna go ahead and just wipe down the table. Alright, and then I will let that dry for about 2 minutes. Miss Johnson, I'm gonna go ahead and now clean up your genitals with using warm water and soap. Do you mind if I just pull down your blanket and pull up your gown to expose that area? Thank you. And would you like me to grab you a towel so we can put it on your torso? No? Okay. So you're already laying flat on the bed. I'm just gonna go ahead and just move your blanket, and I'll put up your gown. So I see that you have a clean pair of chucks, but I did bring the chucks just in case, so I won't be needing to replace that. I'm gonna go ahead and just like reposition your legs into a froggy style, so I have like a better space to place my supplies on. Okay, how does that feel? Feels good? Okay, I'm gonna go ahead and just grab a bowl of warm water and stuff so we can clean you up. Okay, and if you have any discomfort while I am cleaning you up, just let me know, okay? Three and 4. Let me just go ahead and just pat you dry, and I'll just dispose of this. And I'm gonna go ahead and just close the curtain for some privacy. They're already closed. They were half closed. I'm just gonna fully close them for some privacy. All right, Ms. Johnson, I'm gonna go ahead and just gather my supplies and put them on the table. And I'm gonna go ahead and just put down your gown for the meantime. All right. Alrighty, so now I'm gonna go ahead and just place my supplies onto the table. I'll just go ahead and just open up my urinary catheter. catheter kit. I have a syringe so we can collect some urine and send it to the lab. I have my stat lock. I have a CHG pad, and this my extra pair of sterile gloves. Let me just go ahead and just open this box up. And then I'm gonna go ahead and just reposition it. All right, now I'm gonna go ahead and just place my supplies onto this field. So I'll just drop it in my syringe. I will drop in the stat lock and the pad. I'll open up my CHG pad and drop that in. All right. Let me just rip it up just a tiny bit more. Okay, perfect. I'm gonna go ahead and drop that onto the floor. Now, Miss Johnson, I'm gonna go ahead and just take off my gloves and put on some sterile gloves so we could get the insertion in. And I will just be putting up your gown right now. All right. Now I'll put on my sterile gloves. Pull down the cups. And just remove this. Now I'm gonna go ahead and just take these sterile gloves off since I don't need them. Take this off since I don't need it. And just place this down between your legs. And it will be shiny side down. All right, I'm gonna go ahead and just open up my iodine packet and place it into the kit. All right, place it right here. I will also take out my urine sample cup to use that later. Now I'm gonna go ahead and just pop open my gel-filled syringe, and so I can make the insertion just a bit easier. And just pull off the sleeve. And I will just place this in. Now I will get my water-filled syringe and connect it so we can inflate the balloon. And now we will just place all my supplies onto the field. All right, Miss Johnson, I'm gonna go ahead and just clean your meatus with the iodine, and we're gonna go ahead and insert it shortly after. Sounds good? I'm gonna go ahead and just spread the labia open and just wipe with the iodine. That was 1, 2, and 3. All right, Miss Johnson, I'm gonna go ahead and insert the catheter. What I want you to do is take a deep breath in. When I insert it, take a nice deep breath out. All right? Are you ready? Take a deep breath in and out. Great. Keep blowing, blowing. All right, I see urine flowing, so I'm gonna go ahead and inflate the balloon. And I'll just disconnect it. I'm gonna take a nice tug on it, and it seems that it is in place. Now I'm gonna go ahead and get my CHG pad, and I will just clean this so I can collect some urine for 5 seconds. Let it dry for 5 seconds. And I will now go ahead and just kink the tubing so the urine will stop flowing through. I'll collect this, and I will collect about 5 to 7 milliliters of urine. All right, and I will just place this down for later. All right, Miss Johnson, I'm gonna go ahead and just take my supplies off. How do you feel? You feel good? Great. I'm gonna go ahead and just move this off and place this right down. I'm gonna go ahead and just take off these gloves, put on some clean gloves, and we're gonna go and put the stat look on. Okay. All right, I will use this prep pad to prep the outer thigh for the stat lock. And I will just go ahead and just connect the stat lock, and I'll unkink the tubing. Okay, I'm unkinking the tubing, and I'll just place it right here. And I will just move this rest of the bag to the lower part of the bed. All right, and there you have it, Miss Johnson. There is your removal. You feel good? All right, just making sure this is in place. All right, perfect. I'm gonna go ahead and just remove this pad. Throw it out. I'll just, okay. Now I'm gonna go ahead and just, I remove that. I'm gonna go ahead and just take off my gloves so we can collect the urine and get you repositioned. Sounds good? Alrighty, I'm gonna go ahead and just get you repositioned. Alright, I'm gonna go ahead and get you repositioned, and now I'll just collect the urine. Alrighty, and I'm gonna go ahead, put the urine into here, and I will now date it or label it with the name, date, the MRN number, and the time, and I'll send this to lab. I'll go ahead and just dispose of this, and there you have it, Ms. Johnson. That was the insertion. How do you feel? Feel good? Alright, so I'm gonna give you the call bell, lay it in the flattest position. So get in the room, I'm gonna go ahead and now document. I'm gonna document the date, the time, the procedure, your tolerance to the procedure, the size of the catheter used, and just documentation of the urine. Do you have any other questions for me, Ms. Johnson? No? Alright, I'm gonna go ahead and take this to the lab. I'll dispose of my gloves and do hand hygiene shortly after. Thank you, Ms. Johnson. You have a good one.